Your doctors compensate for what your emergency room does not do. The doctors that I have encountered listen, advise, and help me with what I need. In the organization that I'm in, the people that I talk to once a month, some of them won't even go to the clinics in the community. And these are people from Alabama and Georgia. We're just in Alabama and Georgia. But they won't use the clinics, and they won't use the emergency rooms. So you're not great, but you're not as good as you could be. There's room for a lot of improvement.
I am a member of the church, and I'm also the director of the emergency department at Phoebe Worth and Sylvester. So 2 things. One of the things I'd like to highlight is that there are a myriad of issues that are urgent, and I'm not an apologist for our hospital, but I want to be really frank with you in the sense that there are things that we are doing that are working. Since I've taken over as director, we have become a remote stroke center. We have done some things that could not have been done other places. We have become a place where we are a system in which if you walk into any one of our hospitals, our goal is to provide the care that you would get anywhere. And so those are things, becoming a stroke center, making sure that we see our patients within a reasonably timely space. We are also getting physicians that are coming down and helping us out, and also trying to work on making sure that they stay in our community. I think that we could get some help from our community in terms of keeping our physicians here and keeping our nurses here. So that's one thing. The second thing is, I'm also, prior to becoming a physician, I was a journalist for 8 years in New York City, and so I know exactly this person that wrote this article. I know of that place, and what I found interesting is that she's discussing what was going on in Albany. But what I'm saying is I trained in a place in New York City, right around the corner from ProPublica, where the hospital system is falling apart. They literally, as the place that I trained, separated the private hospital from the public hospital. That's how much disdain they had for people who do not have any resources. And so what I'm saying, I say that only because this is a system, this is a nationwide system in which we are demonizing people who do not have resources, but it's happening everywhere. It doesn't excuse what's going on. It doesn't excuse anything. I just want there to be some kind of context that, she could have talked about like my own residency program that had to divide itself. There are hospitals that have closed down in downtown New York City, and you know how much money is, and you know how much money is there, and they still closed. So I just want to give a little bit of context in the sense that these are system-wide issues that we are trying to take into account, and we can do much better. But there are some little steps that we are taking, and I want us to be aware of that. And there are things that we can do, just as we said. If we're able to, let's try to exercise. Let's try to watch what we eat. Let's make sure that let's make sure we're getting vaccinated. The vaccination rates in this community are like plummeting, and we are about to have, I believe, a measles outbreak because South Carolina is the state over, and that's going to impact what we see in the emergency department. Because now we're dealing with measles, we're dealing with strokes, we're dealing with heart attacks, and we're also dealing with things that are now preventable diseases. Diseases that I haven't seen. I've been a doctor for 20 years. There are diseases that I've never seen before that we're going to see. And so keep that in mind, that's going to impact everyone's care. because those people will become, the people will be coming to the emergency room. We're going to do the best that we can. We're all trying, we are trying to do our best, as best we can. We can do much better. We can do much better, and we will. And I'm not making any excuses at all. There have been times in which we as physicians could have listened. We can take our time, we can sit down, we can explain. And so one of my jobs is to do that and to try to impart that to the physicians that work with me. And so we're going to do that. And so my promise to you is that we are going to be doing that from our perspective. That's all I'm going to say.